Walker. I'm the interim CEO of George E. Weems Memorial Hospital. And today, I have with me Dr. Patrick Conrad, our medical director, and we'll begin to talk about certain issues regarding COVID-19, here in our community as well as our hospital. Hey, we understand your concern about COVID-19 and the impact it would have, especially on rural communities, and that's why we're here. We want to begin to share information with you. If I come to the hospital, will I be tested or will I get a prescription to be tested?
If you come to the hospital, will you automatically be tested? As it stands now, no, you will not. Why? We don't have rapid, wide-scale testing yet. Those are coming. They are probably coming within the next several weeks. You've probably been following a lot on the national news about point-of-care blood tests. Those are not available yet, but they are coming. Right now, we have a test that is a nasal swab. It's similar to a flu swab. It's inserted in the nose, and it is sent off to CDC right now in Jacksonville. The closest we have right now is a 4-day, maybe a 5-day turnaround. We're hoping for much more rapid results very soon. If you come in right now and you are asymptomatic, meaning you don't have symptoms, any of the COVID-19 coronavirus symptoms, a dry cough, particularly a fever, possibly some GI side effects, but generally it's upper respiratory. If you don't have those kind of symptoms, what other reasons are there to test? If you've had known exposure in your own family or in close proximity, perhaps at work, if you're from a very highly trafficked area where there's been a lot of COVID infection, we might test, but asymptomatically, generally we won't. Also, if we get a test result back and it's negative, and it's more likely to be negative if you don't have symptoms, then what good has it done anybody? We haven't proven anything yet. So you won't automatically be tested if you come in. We have criteria that come from both the CDC and from the Florida Department of Health, and right now we're following those criteria and then following up with patients that are tested as soon as we get the results. The second question, will you get a prescription? Not necessarily. If you don't have any symptoms, testing is not even indicated right now. If you do have symptoms, you're going to get prescriptions pursuant to the symptoms that you have. If we think that this is a COVID infection, if we really think that someone has it or that someone is at high risk of having it, you probably will be put on some antibiotics. Right now, you've heard a lot in the news about hydroxychloroquine, also known as Plaquenil. We do not have that available. The governor has made steps to try to get that to us. They are trying to get supplies to the state. That is not completely FDA approved. Individual physicians have the ability, if the medicine is available, to begin its use, and we're just going to have to cover that once it becomes available on a case-by-case basis.